Welcome back to the Midlands Air Ambulance virtual open day at Strensham. Now we're going to demonstrate how we treat a patient with a suspected broken leg following a fall. So we've arrived on scene in the helicopter and we've reached the patient whose name is Bob. We're just going to quickly assess and see what's happened to him. First of all, we approach the patient, make sure there's no dangers, which we don't think there is. Hello Bob, can you hear me? I'm just going to place one hand on his head to just make sure he keeps his head still while I speak to him. Becky's just going to have a quick check his chest, make sure he's got no big injuries. Have you got any pain anywhere, Bob? And he tells us that he's got a lot of pain in his thigh of his left leg. So we're not going to get too distracted by that because we're going to do our processes. So we can't see any massive catastrophic hemorrhage. Like I say, his airway's clear, his breathing seems normal, he's got no respiratory distress at all, no obvious signs of any chest injury, and check his circulation. So we're just going to explain to Bob that we're going to have a look at his leg where he says it hurts, but for the purposes of this demonstration we're just going to cut up to here and have a look at his leg. So Becky's going to just remove his trousers and when we do this we're still going to be looking for things we might have missed, like a potential catastrophic hemorrhage from underneath the trousers. We're going to assess for circulation distal to the injury, and we do this by looking at the colour of the foot, check for a pulse in the foot and the capillary refill of the foot. So we can see an obvious deformity to his thigh. There's no open wounds, but he's got swelling and that leg looks a bit shorter. It looks obvious to us that he's fractured the mid-shaft of his femur, which is the big thigh bone. The splint does two things: it stops bleeding and it keeps the bone's edges still and stops them moving around, which helps a lot with the pain. What we'll do is Becky would put a cannula in. I drew up some Analgesia, some strong pain relief, but for the purposes of this demonstration we'll say that's already done. He'd be on some full monitoring, so we'd be checking his heart rate, blood pressure, oxygen levels. Becky's going to come and put some manual traction on his leg to splint it just whilst we get everything in place. The first bit that comes on is the ankle hitch, a fairly padded strap that goes around the ankle, and we pull that so it's fairly tight, so it's not going to move around too much, and we pull the green one first and then we make sure we've got enough length on this amber one. Next is the hip support strap. We put this on by going under the natural crevices in the leg, underneath the knee normally, and then we just carefully slide it up until it reaches the top of Bob's groin area, and we put that in place just so it's level with the top of his left iliac crest, or the top of his hip base on the left. The next part is the supporting pole, and you just pull the pole so it's longer than his leg, so it makes it easy to put traction on, which I'll show you in a second. Is that comfortable, Bob? And I make sure I'm not catching anything or hurting him in any way. Make sure he's still got a good pulse, which he has. So then we attach the amber strap to the bottom of the pole and then manually apply traction at the same time as pulling the red strap tightly, and then we're happy that we can see where the thigh is broken. We're getting some movement and the leg's becoming a bit longer again. That'll hopefully help with any bleeding and swelling and pain within the broken area. Okay, so we're happy it's in a good position, and then we carefully apply the support straps. Becky will do the red one and I'll do the green one. So we'd reassess Bob now, make sure we're still happy with his ABCs, so his airways, breathing, his circulation, make sure he's still alert. So we're going to use this device today. It's called a scoop. For the purpose of this demonstration we're going to pretend someone's still holding his head, and I'm going to roll him over. We'd also have another member of staff or a member of the public, if there's no one here with us, hopefully to help, or the pilot will sometimes help to help support the leg as we roll him, but we'll pretend that's been done because there's only two of us here now. So we'll roll Bob, put him on one end, and then Becky's going to do the same on the other side. Make sure he's still comfortable and happy. Recheck the position of the splint, make sure it's not moved. Make sure his ABCs are still stable, which they are. Strap him on, and then we'll carry him off to the helicopter. On lift. All right, Bob, we're just going to carry you. Are you okay? Yep, all right. Ready, steady, lift. Thank you for watching this Midlands Air Ambulance charity aircrew demonstration of how we would treat a patient that has a broken leg.